So, good day everyone. For today, we're going to have a recap about health assessment. There will be two portions for today's discussion. First, I'll rediscuss the past lessons that we had during the past meetings, and in the second part, you will present your project about bringing health assessment to life. So, all of you will present your videos about the real-life scenarios of our subject. As we all know, health is not only the absence of disease or weakness, but also the state of total physical, mental, and social well-being. Wellness, on the other hand, is a proactive process that helps people become conscious of their choices and move closer to successful living. In our previous discussion, we talked about the health model's purpose is to gain a general understanding of your health across your mental, physical, psychological, and sexual well-being. So, it also aims to identify the primary health and illness concerns, identify the underlying problems, collaborate with the client to solve these issues and concerns, and engage in health promotion. So now, the first presenters may share their screen to present a real-life scenario about this part of the lesson, which is health and wellness.
Hello po.
Hi, Sachi. Balita ko nagkaroon ka daw ng COVID-19 last week. Mukhang healthy and fit ka naman para mag-attend ng mga classes natin. May ibang problema ka pa ba? Oh, sorry to hear that. Okay, sige. Pahinga ka na muna sa ngayon, then pag-usapan na lang natin bukas. Okay?
Okay po.
Sige, bye-bye.
Okay, that's a good presentation and you clearly showed a real-life scenario of health and wellness. So next, we're going to have a recap of the nursing process. The first step in nursing process, health assessment, entails gathering and analyzing client data. So although it is the first stage, the procedure continues. Both subjective and objective data are gathered as part of the health evaluation procedure. So, a nursing process is a systematic approach to problem solving used to recognize, avoid, and treat current or potential health issues as well as to promote well-being. So, the nursing process involves 5 steps. The first is the assessment, then diagnosis, planning, implementation, and lastly, the evaluation. It applies to every issues that affects an individual, a family, or a community. So, the nursing approach focuses on strategies to better meet social and emotional requirements in addition to meeting physical needs. So now, the next presenters may share their screen to present a brief introduction to the nursing process.
Assessment step 1 of the nursing process is the collection, organization, and validation of subjective and objective data. It begins when the nurse meets the patients and start to gather information. This data become a guide for the nurse as to what question to ask and what additional information is needed. Subjective data are information that the patients experience and report to the nurse. The patient's report of pain, pressure, and nausea are the subjective data because the only patient can feel the sensation of pain or pressure and nauseous sensation. The report of fever off and on is subjective because the nurse did not measure the temperature on the previous days. Objective data are observed or measured by the nurse. Example include blood pressure, temperature, skin color, and texture, and heart sounds.
Next is diagnosis, which is a step 2 of the nursing process. In this step, the nurse uses critical thinking and applies knowledge from the sciences and other disciplines to analyze and synthesize the data. Nursing diagnoses may also be reflective of actual or potential problems. They may represent a state of wellness that the patient wants to enhance or optimize. Next is planning, the third step of the nursing process, which involves setting priorities, identifying measurable patient goals or outcomes, and selecting evidence-based nursing intervention that promote the achievement of measurable patient goals or outcomes. These activities need to include input from the patient. Consultation or additional input may also be needed from other healthcare professionals or family members.
Implementation is step 4 of the nursing process. During implementation, the nurse carries the nursing interventions. Implementation of evidence-based nursing interventions promotes the patient's achievement of the goals or outcomes. Evaluation is step 5 and the final step of the nursing process. During this phase of nursing process, the nurse evaluates the degree to which the patient has accomplished the identified goals or outcomes. Based evaluation, the nurse will need to revise certain elements of the nursing care plan.
Okay, that's a great and precise presentation about the nursing process. So moving on, we will now have a quick recap on the two nursing approach that we discussed in our previous meetings. So first is the patient-centered. The distinctive nursing process necessitates care that is sensitive to and respectful of each patient's requirements, choices, and values. So, by upholding the patient's right to make informed decisions and fostering patient-centered involvement in healthcare environment, the nurse serves as the patient's advocate. So, the next presenter may now share their presentation to show a real-life scenario of how the patient-centered approach is.
Good day, ma'am. May I have your name and date of birth, please?
Hi, my name is Kathleen Vibolan and my birthday is on November 25, 2003.
May I know the reason of your visit today?
Well, I have been experiencing headaches for a couple of days.
Is there anything besides your headache that you want to address?
There is none.
So now what we're going to do, Ma'am Kathleen, is examine and assess your health condition by performing physical and medical assessment together with your family history, background history, medical and surgical history in order to determine the symptoms and the cause of your headache. So rest assured, everything will be kept confidential.
Nurse, what are we going to do to relieve this headache? Because I still have so much work to do and I can't concentrate due to the throbbing pain.
Of course, if there will be medications ordered by the physician or the doctor, we will administer them.
Are there any other options? I just don't want to jump into medications just yet. I want to try other alternatives first.
Yes, Ma'am Kat, we can do that. We can have more natural approaches such as practicing different breathing techniques because a slow rhythmic breathing can help our bodies relax. Especially you mentioned particularly that you have so much work to do, which this can be a factor as to why you're experiencing headaches. Can you tell me more about what's keeping you so busy? If you're comfortable with that.
Actually, we're experiencing a financial problem right now. That's why I'm working twice as hard so that I can provide my family their needs.
I understand that. Is there anyone we can discuss this matter with?
Yes, I have my boyfriend. He listens to me, but sometimes I don't want to bother him anymore with all my drama.
Okay, that's a precise and great presentation. So next, we have the interpersonal. So this nursing process serves as the foundation for the therapy process whereby the nurse and the patient respect one another as distinctive individuals. So, and they also gain from their interaction. It requires the nurse and patient to communicate with one another to accomplish a shared goal. So the last presenters will now present their video about the interpersonal nursing approach.
Hello, good day ma'am. I am Chantel and I will be your nurse for today. So may I know how would you like me to address you?
Hello, Princess would be fine for me.
Okay, Miss Princess. Are you comfortable with the environment right now? Hindi naman po ba kayo nilalamig o naiinitan?
Hindi naman po, I feel comfortable naman.
Okay, so Miss Princess, I will be conducting an interview about your health and I highly appreciate it if you cooperate with me. Are you okay with that?
Yes po.
Okay, so let me just verify your information. You are Miss Princess Natasha Jose, right?
Yes po.
Okay. Okay, so Miss Princess, can you tell me what brought you here today? So what is your concern?
I am experiencing headaches and it's been bothering me.
Okay, so when did it begin?
I've been feeling it for 2 days now.
Okay, 2 days. Okay, so can you explain the pain you're feeling right now? Is it sharp or is it throbbing?
I think it's throbbing.
Okay. Okay, ma'am, can you rate your pain right now with 1 being the least painful and 10 the most painful?
I would rate the pain I am experiencing right now at 6. Oh, I actually have another concern.
Oh, what is that, ma'am?
I am worried that I haven't been getting enough sleep because I am having troubles in sleeping.
Oh, sir, you're having difficulty in sleeping.
Yes, I am.
Oh, is there anything that is bothering you that affects your sleep? Can you think of anything?
I think I have been overthinking about a lot of things since a lot is going on with schools and stuff.
Okay, so maybe that explains your headache. If you don't mind, you can stay here for a while and we'll talk about it.
Yes, I don't mind.
Okay, Miss Princess, if you want to talk or to share anything, I'll be listening to your concerns.
Okay, that's a great representation of the interpersonal approach. So all of you presented well, and I noticed that you really understand the lesson well. So it is important that you pay attention to studying and thoroughly understanding health assessment because it will serve as a foundation to your nursing journey. So I'm impressed with how well you presented each parts that are assigned to you, and I guess we can end it here so that you can take a rest. So thank you everyone and have a great day.